Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to see one more topic under hematology, that is Sideroblastic Anemia. So let's dig into it. Definition goes like this. It is a disorder of heme synthesis characterized by ineffective erythropoiesis and accumulation of iron in mitochondria of erythroid precursors, forming ring sideroblasts in the bone marrow. Okay, so just remember in the definition you learned about what it causes is like excess iron deposition takes place in the mitochondria, which leads to ring formation. We call it as sideroblast in bone marrow. Okay, then coming to etiology, we have congenital, then acquired. In congenital, we have X-linked sideroblastic anemia due to, remember, ALAS2 enzyme deficiency. What is that? ALAS2 enzyme deficiency. Then in acquired, we have myelodysplastic syndrome. Just use the comment section. Somewhere in the videos I told myelodysplastic syndrome will be a complication of some anemia. You can use the comment section for answering it. Then chronic alcoholism, drugs isoniazid, chloramphenicol, linezolid. There is one more anemia caused by chloramphenicol. Even you can answer that in comment section. Lead poisoning, copper deficiency. Pathophysiology, I put it in a lines because you can, if you remember these lines, you can make a big flow chart or big stories, however you want to write. So just try to remember these lines so that you can make a stories or flow charts. Defective heme synthesis in erythroid precursors leads to impaired incorporation of iron into protoporphyrin. So there will be defective in synthesis, which leads to defect in production. Okay, incorporation of iron into protoporphyrin. Iron accumulates in mitochondria around the nucleus, formation of ring sideroblast in bone marrow leads to ineffective erythropoiesis. So there is some content missing and something is depositing in some other places. So it leads to defective formation. So which leads to ineffective erythropoiesis. Increased iron absorption and iron overload is seen, which leads to microcytic or normocytic anemia develops. So most commonly you are going to see microcytic only. Okay, just look into pictorial thing. Porphyrin synthesis will be defective, which leads to heme synthesis reduced to cytoplasmic maturation. And porphyrin synthesis, defect will be there, so which leads to microcytic hypochromic anemia, as I said. And there will be abnormal erythroblast, which leads to Pappenheimer bodies. We'll discuss in the HP peripheral blood smear. And at last, it leads to iron overload. Only two things you need to remember: there will be defective erythropoiesis, which leads to microcytic, and there will be excess of iron depositing around the mitochondria. Okay, these 3 points you need to remember in pathophysiology. Then coming to clinical features, like you can make a small blunder like stuff in anemia. Every time you can write symptoms of anemia: fatigue, weakness, pallor in almost all anemias. Okay, don't tell me if it get wrong. Don't blame me. Okay, just a trick. Features of iron overload: hepatomegaly, cardiomyopathy. In chronic cases, we'll see alcohol-related symptoms in acquired cases. Why? I want to know if you know more. So then investigation, we are going to see hemoglobin will be reduced. Obviously, there will be defective production. Then MCB usually low or normal. I think this I explained in my iron profile video. You can go and watch. Then peripheral blood smear, dimorphic red cell production, hypochromic cells may be present. Then iron studies. If you don't know what iron study involves, then please go and watch my iron profile video. Please. If you don't know this, you are going to fetch anything in this hematology. Please go and watch my iron profile video. Iron studies: serum iron increases, serum ferritin increases, TIBC decreases or normal. Why this condition happens, I explained in my iron profile video. Kindly watch it, please. Then bone marrow examination, diagnostic ring sideroblast on Persian blue stain, as I explained this in my definition itself. And coming to peripheral blood smear, you are going to see Pappenheimer bodies. Then in special stain like Persian blue, you are going to see sideroblasts. Then coming to diagnosis, it will be confirmatory. You can say if you see ring sideroblast, it is unique feature of this sideroblast anemia. Then DDs, iron deficiency anemia, thalassemia, anemia of chronic disease. Just remember, ACD means anemia of chronic disease. people tend to make wrong. They'll be knowing the content, but instead of knowing that short form, you will lose the marks. Just remember, ACD means anemia of chronic disease. Then management, treat the underlying cause. Obviously, this is caused by something else, so you have to treat the cause. Then stop the offending drug if any isoniazid, linezolide, or chloramphenicol is given, so you have to stop that. Then vitamin B6 supplementation you give. Then chelation therapy in iron overload, because iron you have to throw it out, so you have to give chelation therapy. Blood transfusion, if there is like too much low hemoglobin and all, then you can do blood transfusion if it is very severe and necessary. Complications, you're going to see iron overload will be there, and cardiac and liver dysfunction. This is caused by something else, so you have to treat the cause. Then stop the offending drug if any isoniazid, linezolide, or chloramphenicol is given, so you have to stop that. Then vitamin B6 supplementation you give. Then chelation therapy in iron overload, because iron you have to throw it out, so you have to give chelation therapy. Blood transfusion, if there is like too much low hemoglobin and all, then you can do blood transfusion if it is very severe and necessary. Complications, you're going to see iron overload will be there, and cardiac and liver dysfunction.